Hello again. Welcome to another episode where we're still talking about infertility. Today, I just want to share some information regarding number one, characteristics. We're going to characterize infertility. What really is the character of infertility? Are there types? How do I know that my spouse and I are probably infertile? And then what should I do? So the first thing is infertility are basically there are two types. So there's the primary infertility and then there's a secondary infertility. What does that mean? Primary infertility is a couple that have been trying to conceive but have been unable to conceive for the first time. So they have never had any children. That is primary infertility. Secondary infertility, couples that have tried, they've gotten pregnant once, but then after the first pregnancy, they are struggling now to get pregnant again. All right, so primary, no pregnancy before. Secondary, maybe one pregnancy, and then after then it's very difficult to conceive. Both of them are an issue in our country and society today. Now what are we going to talk about is the next thing we talk about is the cause. What causes infertility and why is it like a major problem in our society? It was never a problem. I know of families who their issue was actually birth control. They're trying to control the ability to conceive, but now it's like we're even trying to conceive in the first place. Now, what we've discovered through science is there is the male factor, a female factor, and a third option is unexplained. We don't know where the problem is. And of course, some people will say it's a spiritual problem. Well, I leave you with that. But I'm going to focus on just the two scientific parts to this, male factor and the female factor. Let's talk about the male factor. Why? Because that's the part I feel is neglected. There's not much push for the male factor of infertility. So, first reason. Now remember that when it comes to the male, the complexity of what the body does in producing the sperm is not really as much as that of the female. The whole process kind of seems simple, but really there's a lot going on in the male as well. The male has certain organs that I'll pay attention to, and I want you to remember three things. Number one, quality. Number two, production. And number three, availability. Quality, production, availability. Now, the male reproductive system is organized to produce sperm, and these sperm are traveling in semen. So if the semen is not adequate, the likelihood of sperm being adequate is very low. So semen problem, and that's why one of the first tests is a semen analysis. So the semen is what the sperm swim in. So it has to be nourishing the sperm for them to be alive, for them to be strong, and for them to be very good at swimming, because it is really a swimming exercise from the time they're ejaculated out of the male penis into the female's womb, and they have to travel all the way to where the egg is to be able to fertilize. If that sperm has a very bad head, it won't be able to penetrate the thick coat of the female egg, and that's a problem already. So it will be difficult to fertilize that egg. Number two, if that sperm has a problem with its tail and it does not know how to swim, then it will be attacked by the female's own system, and of course no fertility. And the number three is the number. The number of sperm available in the semen is also important. All these three factors are considered when analyzing semen. That's the major part. So what causes issues in all of these? Infection, chemicals, some genetic mutations, and so many other issues that affects every part of the male organ, including the scrotum, that scrotum which holds the testis, the epididymis, the prostate, all of these parts. I don't want to bore you with too many names, but just know that all of these are important for the male. Also, infections have become a problem, especially sexually transmitted infections. So that's with the male. Now let's come over to the female. Now I know a lot of you have watched videos about the female reproductive system, how they cause infertility, and in fact the female goes more about health seeking as compared to the male, sadly. But I want to encourage you at that when trying to figure out why you are infertile, don't just pick one. Both of you are in this together. In fact, in my practice, I have discovered that when I talk to couples together, I have better results than when I'm talking to just one, just the male or just the female. Of course, most times it's just the female, but I'm encouraging you that when you are seeking for help, do it together. No matter how busy your schedule is, where is your priority? If your priority is to conceive, then both of you have to do this together. Now, back to the female. For the female, there are certain parts of the menstrual cycle that actually are a pointer to whether this woman is fertile or not. Fertility issues are not something that just start overnight. They are signs that lead to that. For the female, it could either be the amount of eggs within the ovary, if they're not strong enough, if they're not able to ovulate. She's maybe having cycles where she's not really ovulating, there's no egg available for fertilization. Another one is maybe a blockage in the entire tract. Maybe from the tubes there's a blockage, the egg can't even go forward and the sperm cannot even reach the eggs, right? Another thing is the quality of the egg. Sometimes they're not even healthy eggs, and so fertilization is, of course, wrong. The other thing is the hormones, because hormones control each part of the cycle to be able to enable and nourish and manage the conception. Now, without the presence of these hormones in adequate levels, there's going to be a problem with conception in that area. So I've talked about the quality of the eggs. I've talked about patency of the reproductive tract. And then the other thing is the hormones, and of course, infections. Multiple recurrent infections can also cause or lead to an issue with fertilization. Another one that's becoming a trend is the presence of fibroids. Fibroids are an issue when it comes to fertility, but not all fibroids can lead to infertility. And so that is an area that needs to be paid attention to. In all of these, let's put it together. For a family to know that they have issues with infertility, number one is, according to that definition, has it been over a year? Has it been regular sexual intercourse? Has it been not just sexual intercourse? Some people are doing oral sex, anal sex. All of these do not lead to conception. They don't lead to you having a baby. So it has to be the way naturally designed for a couple to conceive. The next thing is, what do you do? That's in the next episode. I will tell you what are the major steps you need to take, step by step, practical ways that you need to consider before you go and spend millions trying to do an IVF. There are things you should do before that. So, I'll see you in the next episode. Thank you.